Here we go. We might be live. It says it's still setting up, but it's also telling me it's live, so I don't know for sure. Welcome, welcome. This is episode 258, where we're talking about your vision. So let us know how your vision is. And I'm just going to put this as a disclaimer here. Dr. Saunders is a medical doctor, but he is not your doctor. And so we do ask that you chat with your healthcare provider before you implement any of the things that we talk about today. Okay, I think it's going. All right, we went live. Wonderful. All right, let's dig into this today. I'm already getting some feedback here from you guys. I'm going to look through here, look through the chat. Elliot is here. Hi, Alice from Montana. David is back. Terry is back. Tom is back. Hello. Delma, Don, Kay, Rinda. Allison is back. Gladys, hello. Butch is back. Hi, Barbara. Debbie from Bermuda, welcome. Sylvia is here. This one says Remax Display, but I don't think that's your name. What was the CGM that Joe mentioned last week? I must have written it down. Did it start with an S?
I don't remember.
I'll look. I think I have it somewhere in an email. I'll look. Sylvia said it got worse after I started wearing my prescription glasses about 6 months ago. Oh, interesting. Don says my vision is very blurry at time. Vision is great. Okay, except for readers, my vision is good. Had RK surgery many years ago, but been using glasses for several years. What is RK? Retinal something?
Yeah.
I'm not sure.
Yeah.
Okay.
Right.
Delbert says hi. Hi, everybody. Tanya's here from Chicago. Rebecca from Indiana. Okay, great. Mary is back. Hello, everyone. Did I get most of those? Dwight? Yes. My vision is good. I use readers, Tom says. Okay. And there is quite a concern, and I hear this chatting with some of you. You find out you have type 2 diabetes. Maybe your numbers are a little high. You're not able to manage them well. And then there is some scare about vision problems. So, Dr. Saunders, what does that mean? Why would a type 2 diabetic need to be concerned about vision problems?
Okay, so when we talk about type 2 diabetes, we're looking at a problem with metabolism or the ability to convert energy. So it's not that you don't have energy, it's that you have too much energy. And because of that, the way biological systems work is they block out excessive anything as things become toxic. They block them so that you don't get too much of anything. So when you have a cell that's filled up with glucose, then it stops making insulin receptors so that the insulin can't get into the cell. The same thing happens when you have high levels of glucose for long periods of time. Your blood-brain barrier makes fewer of the glucose transport molecules that bring glucose into the brain to have for energy. So what's happening here is there's several different issues going on. One is a lack of energy. There is just less energy around. Number two, there's less energy from ketone bodies. Ketone bodies is where you burn fat for energy. Ketone bodies do not require transportation to transport across the blood-brain barrier. They go straight through and get in there and do their work, and they could be used for energy in many of the cells of the brain, for example. So when you're not burning as much fat, you make less of these ketones, and you have less of that energy available, of that instant energy available. It doesn't have to be transported. So you have less ATP, less ketone bodies. And then the third problem is you have to burn more glucose for energy. Glucose is a high octane fuel that makes a lot more oxygen-free radicals. So you have a higher level of oxygen-free radicals, you have more inflammation, and all of this is happening while you have less energy available. So the retinas are exquisitely sensitive to all of these things. And so if you lack energy and if you have more inflammation, then it's going to do damage to those retinal cells. Just lacking uh, um, energy just briefly. So, for example, if you hold your breath long enough, what's the first thing that happens? You get a little bit dizzy and your vision goes dark. Your vision goes dark first. People that have migraine headaches have constriction of blood vessels, and they very often, it affects the retinas first. They start getting what's called an aura, which means they start seeing things in their eyes. Sometimes it's spots, sometimes it's squiggly lines, sometimes their vision goes like they get tunnel vision or shades coming down, and these various visual disturbances. Why? Because as the blood vessels constrict down, there's less blood flow. And so they're getting more, and so that they're not getting enough energy. And so they just don't work. And so that's where a lot of the problems with diabetes comes in. We have with type 2 diabetes an energy problem. And the retinas are very exquisitely sensitive to that. So for all those reasons, diabetes is the number one cause of diabetic retinopathy is the number one cause of blindness in working adults. It's fairly common. There's about 1 million people a year go blind because of diabetes. Now that's a small percentage, like 4% of people with diabetes go blind. So it's not like everybody that gets diabetes is going to go blind, but it certainly is a risk, and it's a big enough problem that's even though it's a relatively small risk compared to neuropathy or heart disease or renal failure, it's a big deal. And not just that. If you have diabetes, you're twice as likely to get glaucoma, which is breaking down of the retinas in the eyes, often associated with increased pressure in the eyes, but not always. About half the time you get increased pressure with that. But you can get glaucoma and cataracts, 4 times more likely to get cataracts if you have type 2. Blood sugar is not under control. So all of these are different ways that you can go blind, technically. So, for example, like with cataracts, yeah, you can go blind, but they can pop that cloudy cataract out and put a clear lens in, and then you can see again. It's a miracle, right? But if you can avoid that surgery, then you can avoid the risks of that because there are risks associated with it. So blindness is not a minor problem. It is very important.
All right. I this is a question that just came in though, and this is interesting because 2 people have said this. Their vision is okay as long as they don't eat sugar, and then it goes blurry.
Okay, so blurry is different than blindness. So let's talk about vision and blurriness. When your eyeball makes inside, it makes a gel, and this is a clear gel that fills your eyes, that allows light to pass through it very well. And then you have a certain distance of your lens in front of your eye to your retina in the back of the eye, and the light has to go through this gel. When you eat a lot of sugar, the gradient difference of the glucose in the blood compared to the glucose in the eye causes water to either come out of the eye, shrinking the eye, or to come into the eye, blowing the eye up bigger. So you can have vision changes. You can have a lot of vision changes. People get glasses, and then they realize after they get glasses, oh my gosh, this is the wrong prescription. And a lot of eye doctors will check blood sugar if you have diabetes and say, get your blood sugar under control first. Have normal blood glucose for at least a couple of weeks, and then come in and have your eyes tested. Otherwise, you don't know. You could be having your eyeball could be a little bigger than usual, and then you can get blurred. So if you eat sugar and your vision gets blurry, it's because your eye actually has shrunk down. It actually does that. So this concentration gradient.
Wow, very interesting.
Yeah.
Okay.
Osmotic pressure changes cause the the eyes to shrink and swell.
Okay, so someone here had said I've had a couple of laser surgeries on my eyes, and I've had shots in my left eye. Why are we doing shots in our eye? What would that be for?
Well, when I was a kid, there was this saying, cross my heart, hope to die, stick a needle in my eye. So when somebody tells a lie or something, then you're supposed to stick a
You're
needle in
supposed
their
to.
eye. So I think
Oh,
that's what
that
the
makes
problem
sense.
is. They're liars. That's why. The needles in the eye are most often an injection of something, usually a corticosteroid of some kind, and it's a cortisone to stop inflammation. And so, if there's an inflammatory process, it often works because it kills all the cells that cause inflammation. The problem is, it also does damage to retinal cells and everything else. It's a catabolic hormone, so it breaks down everything. It breaks down the connective tissue. Yes, it's temporarily relieve the inflammation in the eye. And like I said, for reasons of there's the inflammation is there because there is a more oxygen-free radicals because you're dependent on glucose for energy exclusively and can't use fat for energy. And there may not be enough antioxidants. That's another common problem, actually. And it's been shown, multiple studies have shown that an adequate supply of antioxidants is enough to prevent macular degeneration, glaucoma, and damage to the eyes, including cataracts. So because of all the oxygen-free radicals that are being produced, antioxidants are a very important part of protecting your eyes. So they have vision supplements. It's called REDS2 vision supplements, and that's the study. The study was the REDS2 study that showed this combination of antioxidants really works to prevent the damage to the eyes, including the retinas and the lenses. So it includes zinc and vitamin E, and then lutein and astaxanthin and zeaxanthin, and they're really worthwhile. It's something that I'm taking now, this eagle eye vision, after I read the studies on it. I'm going, you know what? I should take this. I'm not really much for taking supplements, but this is one of the ones I take.
And I'm showing you bartonnutrition.com, so you can find all of our supplements there. I love this bottle. It's so pretty too. But you can see the list of all of the ingredients that are in there, and use code webinar25. That's one word. You'll save 25% on this. So the vitamin C, vitamin E, B3, magnesium, zinc, copper, coenzyme Q10, xanthogreen powder, bilberry, saffron. Anything else? That's it.
Yeah.
Really, really good. And I think this is our newest product that we've released. So some of you probably haven't heard about it. You maybe have seen some emails. We've maybe only talked about it a couple times, even on the webinar. But tell us, okay, so who needs this, Dr. Saunders? Who would this be good for? Well, I'm taking it, and I'm like, well, I think I need, every time I learn about it or I read an email that we send, I'm like, yep, that's me, but I can't even remember why. So why do we need this, Dr. Saunders?
It's not that everybody needs it, it's that everybody who's at risk needs it. And the problem is, how do you know you're at risk? And that's where a lot of the issue comes in. There are a lot of studies to show that supplements are not useful, that, oh, you shouldn't take supplements, oh, you're just wasting your money buying supplements. But the reality is, if you go back through history, um, people had deficiency diseases. Like, it was common to go blind. You know what the number one cause of blindness in the world is? A vitamin A deficiency. It's not diabetes type 2. So we always qualify that. Diabetes is the number one cause of blindness in American adults. So blindness in children, vitamin A. And if you look at the worldwide, it's pretty big and it's really important. So vitamin deficiencies were well known by all doctors prior to the modern era. So, a doctor would commonly see people with scurvy and beriberi and rickets and kwashiorkor. And I can't say never, probably never seen a case of any of those. We do get a lot better nutrition today, but to go so far as to say that you should never take a supplement because you should get it all from your food. Well, yeah, that's ideal, but that's never been part of the human experience throughout history. Never. There has never been a time when we have been better nourished than we are now. And we still see like vitamin A deficiency in children around the world. And we still see problems with nutrient deficiencies. Vitamin D is very common deficiency. And we see the problems with that. People are walking around with osteoporosis. They think they can take a drug and they don't know that they've been living with deficiency of vitamin D all their lives. And so they need to fix the problem. Well, so I think that taking this kind of thing, and the way I look at it is it's worth it. I take the bilberry is kind of like berberine, and then the astaxanthin, zeaxanthin, lutein. These extracts are good for a lot of different things in your body, and it's just useful. And another thing I was thinking about, the zinc. Males are commonly deficient in zinc. Males require zinc to make testosterone, and testosterone problems, prostate enlargement, are often due to a lack of zinc over a long period of time, a low-grade zinc deficiency. And so that can be a problem. Females have a lack of iodine. They require iodine to make estrogen or to convert estrogens. So it's very common in young women to have iodine deficiencies, and it's not that common in young men. So we do see deficiencies today. When they did a study about 15 years ago in the Midwest on women and found young girls in high school were already getting goiter, enlarged thyroid gland, from a lack of iodine. So just to say deficiency doesn't exist and you should always get it from your food, it's not reasonable. It's not. We try to get it from our food, but people take the wrong kinds of supplements, or they take, or eating processed food, you're not getting all the nutrients. And they tell us that the amount of nutrients, the nutrient density of food is declining because the soils are not as filled with minerals as they used to be. And so for all those reasons, I think, yeah, I would do it. I do it.
Yeah. All right. I'm going to dig into some of these questions here that have come in. Allison said, my potassium has been consistently high. Normal is 3.5 to 5.3. And I'm always 5.4. My doctor is paranoid. What is the true range for potassium before you need to worry? Thanks, Allison.
Okay, Allison. Okay, so here's the deal with potassium. The amount of potassium in your blood is a tiny fraction of the potassium in your body. The inside of your cells have a very high level of potassium, like 1,000 to 1 level of potassium. So inside the cells is all the potassium. Outside the cells is a little bit of potassium. When your blood potassium is high, then you have a problem, and it's usually a hormonal imbalance of some kind. You can look at the renin, aldosterone, angiotensin system. That often affects, aldosterone is a big one that affects potassium. But there's usually some endocrine problem, some problem with the hormones in your body that are supposed to let the potassium go. So your kidneys aren't functioning right, and so you may be in kidney failure, because if your kidneys are not working, then they won't be able to get rid of potassium, and your potassium level will go up. So high potassium is not normal, number one. Number two, it's not healthy to have high potassium. It affects how your muscles contract, and your heart is a muscle. So it affects how your heart contracts. It affects people get cramps and all kinds of problems with potassium, changes in potassium. It affects how your nerves work. So number two, it is not healthy to have that. And number three, it's a marker for some significant problem in your metabolism in your body.
All right, John said, I recently read that beans can cause issues for people with type 2 diabetes. Comments?
Yes, beans are wonderful. Beans are like the best food in the world. If you have beans and rice, that's pretty much something you could live on all your life and be pretty healthy and get most of your nutrition, and it's really good. However, beans are a carbohydrate, and they do have a significant amount of carbohydrates. And so if you're on phase 1 of the program, then you could overload your your program with carbohydrates eating beans. So generally, phase 1, beans are not used. I think 20 grams of carbs is only a half a cup of beans. So it's a half a cup of cooked beans. So it's a small amount to get your 20 grams. But 20 grams of carbohydrates is not that much, really. So the fact that there are carbs in beans, they're not really high carb. They're not really high carb foods like starches and sugars and all that. So I don't think you could blame beans as a cause of diabetes. I really don't.
I see some questions coming in the chat. If you guys can post those in the Q&A, that'd be really helpful to me. Thank you. All right, Kimberly said, I started cutting my carbs 2 weeks ago, 60 to 75 grams. I'm losing weight and noticed my blood sugar decreased to 115 to 130 when once was 160 to 180. I started phase 1 this Monday. How long do I do phase 1? I was on metformin, but I'm not taking it since I'm completing phase 1. Do you think that's a good idea?
Yes. Okay. So the answer to your second question is yes. The answer to your first question of how long you should go, it depends on your body. Some people go 2 weeks and they're like, gee, my blood sugars are all normal. Everything's good. I'm going into phase 2. And they go into phase 2. Some people are 6 months out and they're going, what the heck? My blood sugars are still, blood glucose is still elevated. My hemoglobin A1C is still elevated. And they have other issues going on. So, everybody's different, and you have to work with your body. If you have specific questions, that's why we have this program. Think about it. You can write a book, but you can't put every eventuality in a book, because every single individual is different. And that difference means that they may have to tweak it a little bit different than somebody else. So how long you go depends on what your needs are. And so the best way is to monitor your glucose Look at it every morning when you're consistently, for a week or two, you're consistently in the 70 to 90 range. Hey, I would say you're ready.
I'm going to show you guys the diabetes solution kit because I know some of you are wondering, what are you talking about? What is phase one? Here you go. This is the book that you can find at bartonwebinar.com. And some of you have ordered this. You've ordered the digital version of it, which is under $20. So you can have that today, download it. You could print it out if you wanted to, or you can order this printed copy. But we talk about phase one, two, and three in this book. And that's why we're talking about carbs, lowering your carbs, and those are net carbs, and all of that information is inside of this. So bartonwebinar.com. Hey, if you want to save even more, use code webinar25. You'll get 25% off of that 1997 or whatever it is. So whatever dollar amount that is, with 20%, 25% off, let me know, someone. That's a lot of math to do in my head. That's not going to happen. So it's a good deal though. All right. Bobby says, this is good. Is it true you should get a special diabetes eye exam?
If you have diabetes, you definitely should get regular eye exams. And pretty much any ophthalmologist and most optometrists are able to do that kind of thing. And what they have to do is be able to see the retinas. And there are various ways of doing that. Some of them have drops to dilate the eye they can look in. Others have a microscope they look in. And then others have the reflector that they can see with. But any way of looking at the retinas can tell what's going on, if there's any issues coming up in the retinas.
Okay, so this next question is from Tom, and it says, since I have type 2, should I be taking it says carotene, but I wonder if it's carnitine. If so,
Yes.
how much?
Okay, if you have type 2, do you need L-carnitine? Okay, so that's a good question. And I've actually looked into this a little bit. L-carnitine is normally made by the body. There's all kinds of it. There's acylcarnitine. There's all kinds of carnitines that are used by the body. And what carnitine does is it is a transport molecule that helps fat get into the mitochondria so you could use it for energy. So if you don't have carnitine, then you can't use fat for energy. And that's one of the ways that insulin blocks the use of fat for energy. So I couldn't find any specific research on the use of carnitine in diabetes for improving mitochondrial function, but I would suspect that it would be very useful when Dr. Stephen Sinatra did his work with the heart disease, congestive heart failure, which a lot of congestive heart failure is due to energy problems, which is related to type 2 diabetes or insulin resistance. He found L-carnitine to be very useful. So I think it would be a good thing. Okay, and if so, how much was the next question, right? And it takes grams, so usually 5 grams a day, kind of thing. 2 grams twice a day, maybe 4 grams a day, that kind of thing. With food.
With food.
Yeah.
Okay. Mary said, I've had a cataract removed from each eye. My eyes have been watery since then. I don't know if that was a cause and effect or advancement in diabetes. My eye doctor keeps asking me if I'm using eye drops, and I tell him I'm not, but he hasn't done anything about it. My left eye is a little blurry. I've started taking eagle eye vision, and it seems to be helping a little.
Okay. So the watering of the eyes could have something to do with the surgery. Post-surgical, you can have that kind of thing, watering of the eyes. Another thing to consider is the tear ducts that drain your eyes into your nose to dry out your tears in your nose, and make your nose a little wet on the inside and prevent it from drying out. Sometimes those tear ducts stop working. So that's something your eye doctor should look at. And they can do a test where they put a little drop of a dye in the eye, and then they see where it comes out, if it comes out in the nose like it's supposed to. And they can test your tear ducts to make sure they're working. And if your tear ducts are not working, then you're kind of always going to have kind of watery eyes. And so one of the things to check is the tear ducts.
Okay, very interesting. Anonymous says, do you recommend for users of Cinechroma to follow 5 days on and 2 days off, as you have recommended for use of berberine? I'm following phase 1 of the diabetes solution kit and making steady progress. Blood in terms of blood glucose and A1C results. Thanks so much.
Yeah, short term, for Cinechroma, when somebody has significant type 2 diabetes, using it daily, even twice a day at first. And then when you graduate to phase 2, then going 5 days on, 2 days off is a fine way to do it.
Okay. Next question here. What is the discount code again? That's an easy one. Okay, webinar 25, and that is one word. Whitney says, are there any tests that show what vitamins and nutrients we are deficient in?
Supposedly, the problem is none of them are great, but they can be somewhat helpful. You can actually do blood tests at your local lab and look at your B vitamins and mineral levels and amino acid levels. There's also a test. I usually use one called a NutriVal. It's Genova Diagnostics from North Carolina, and it's a kit, and it's urine and blood, and you use the urine and blood. It gives you a functional analysis of your nutrients and not levels. You're not looking at how much B vitamins you have. You're looking at how much methylmalonic acid you have to see if your B12 is working, and how much 5-GLU you have to see if your folate's working. So it's like a different way of looking at it as a functional analysis. That's what I prefer rather than levels. Sometimes levels don't give the whole picture. You can have normal levels of a lot of different vitamins and have them not be functional because they're not being methylated or they're missing a cofactor and all of that. So you actually have technically normal levels, but like if you have MTHFR deficiency, that's the enzyme that converts the inactive folate to the active methylfolate. If that enzyme isn't working very well, then you can have normal levels of folate, but it's not working, not functional.
All right. Okay, so I maybe address this, but Allison said, is 1 over normal that bad? And I think that was in reference to potassium, her potassium score. Remember the levels were up to like 5.3 and she was at 5.4?
Yeah, 5.4. Yeah. So 1 over, no, it's not that it's bad. It's not that level by itself is bad. It's that there's a reason why you have these higher levels of potassium. And it's important that you look at why your levels are high. Sometimes it's as simple as dehydration, sometimes, but most often it's a kidney dysfunction of some kind, and often from hormones and what I discussed before.
Okay. Let's see. How do I sign up for tomorrow's webinar? At bartonwebinar.com. We have our Healthy Heart webinar tomorrow, so we'd love to have you join us there. Thank you for asking that, Elliot. Same type of format where we talk about how to keep our heart healthy or how to reverse heart disease, etc. So really good webinar. Okay, there was a question here. Let's see. Please explain phase 2 of the diabetes solution. It's in the
okay.
No, just kidding.
Okay, we've done a whole webinar on this where we explain going into phase 2, when you go into, why, what you're doing. So basically, phase 2 is you're doubling the amount of carbs you can eat, and so you increase the level of carbohydrates. And it's kind of specialized in some way in that you're still avoiding simple sugars. You're still going to avoid things like sugar and sweet things, and you're gonna instead eat more complex carbohydrates like vegetables, and so adding more and beans and things like that. So as you're adding these extra carbs in and sort of rounding out your diet, and that's according to your desires, your likes, dislikes, and so that this is where you start individualizing the program to say, oh, I can eat this and I can't eat that. Well, how do you know? Well, as you're going through phase two, you still monitor your glucose. And if you start seeing it go up, then you go, aha, can't do that anymore. I often say as I go back to this, because it was so interesting, that someone on our program said, you know what? I have no problem with bread. I can eat bread. My blood sugar stays the same. But as soon as I ate nachos, my blood sugar shot up over 200 again. So it's a learning process of what I can eat, what I can't eat. And for everybody, it's going to be a little different. So this is where you're individualizing your program.
All right. Somebody had asked about that continuous glucose monitor. If any of you remember the name of it, will you let me know, because I'm not finding it. Actually, hold on one second.
I looked it up.
I thought it started with an S, but not finding it at the moment. Okay, I will keep looking for it though. Somebody else asked about what does drinking cold water or cold ice water do to diabetes? Any thoughts on that?
What does it do to diabetes? Well, ice water tends to constrict blood vessels. It decreases the core temperature. I don't think it affects insulin resistance. I don't know. I haven't seen any studies specifically on drinking, because water has no calories, no flavor. So I wouldn't expect it to have be much of an issue. I don't know.
Okay, I don't know if this is the glucose monitor, but I just saw an email that I had gotten in August call up from Stello by Dexcom.
Oh yeah, that's it. That's it.
Okay.
It's the Dexcom.
So I'm going to post this actually in the chat here. Yes. So it's a monthly subscription. Yes. All right. There you go. And I'll give that to you on YouTube in the chat as well. There we go. Oh, yeah. Someone else had mentioned that too. Thank you, everyone. All right. More questions. Edward says, Edgar says, I take Cinechroma in the morning and turmeric BP with evening meal. Is that enough to keep my blood sugar level normal?
No. Okay. The answer to your question is really with a question. And the question is, what does it take to keep your blood sugar normal? Because your blood sugar is going to be different than everybody else's blood glucose. You're not going to have the same response if the supplements that you're taking, or even medications or anything, don't address the specific issue that you have. So we're all different in how we process carbs and fat and protein, and what kinds of nutrients we're deficient in. So if you're deficient in chromium, for example, you could totally get normal just by taking Cinechroma and nothing else. But we've seen cases of that, and we always comment on it and say, don't expect. Your results may vary.
Yes.
Everybody's not the same as far as this taking the supplements goes. So don't expect that the pills, the supplements, medications, or anything are going to control your blood sugar. That's not the point. The point is that type 2 is that you are toxic on glucose. And so the purpose for phase 1 of the program is to detox. That's all it is. It's a really simple detox. you're getting off of all the toxic levels of glucose that are filling up your cells and allowing them to some breathing room so that they can take some in and use it up and take it in and use it up. And there can be some back and forth there. Whereas right now, they're shut down. And that's one of the reasons we talked about blindness. That's one of the problems with blindness, is that being shut down, the cells being shut down. That's not a good thing.
Our friend Bill said that he just had his eye tests and they're all good. Bill from Australia. Thank you.
Yay!
All right. Alice said in February, I had a sinus infection that created cellulitis in my eye. The
Ouch.
retina has been inflamed ever since. So that was in February. The inflammation has been unresponsive to steroid eye drops, and I'm allergic to NSAIDs, anaphylaxis. Any supplements or other meds that might be useful?
Wow. So the sinuses, a lot of people don't know that the sinuses are cavities in the skull. It's the bone. The bone has these pockets in it that are holes, and it's just filled with air. And this one, especially the big maxillary one, where your teeth grow up into that cavity, and then on the other side, the bone from your eye, between your eyeball and that sinus, is like paper thin. It's like a super thin bone. And so if there's chronic inflammation, it can eat through and get infection in the eye, cause inflammation in the eye. And so that's well, actually there's other ones too. There's the sphenoid sinus and the ethmoid sinuses. There's just a very small, narrow little bone between these air pockets and the eye. And so if any of them are chronically inflamed, they can cause inflammation, even infection, if they break through and get into around the eye socket. That's hard, man. I would wonder, is there infection still there? If you're still inflamed, is it inflammation? Why is the inflammation there, is the question. That's my question. Is it still infected? Is that really the issue? In which case, dealing with the infection will then get rid of the inflammation. And so that's where I think looking around for an ophthalmologist that can help you with that would be a really good idea.
Right. I saw a question that someone had asked about which episode numbers are phase 1, phase 2, and phase 3. Phase 1 is episode 222. And then phase 2 is 224. Phase 3, 226. So you can find a link to our YouTube channel at bartonwebinar.com. Click on that link and you can find all of our episodes. So you'll find a lot of good information there for you. But you can also get the book, which is at bartonwebinar.com as well. Use code webinar25. Good question here from Whitney. Is the carnivore diet a perfect detox diet?
Well, it's hard to say perfect. The word perfect means complete, and it's kind of hard on the carnivore diet to have complete nutrition for everything. Some people do really well because they're eating organ meats, and so if you eat liver regularly, then you can get the vitamin C and B vitamins, or whatever nutrients that you're missing from just muscle meat. So it's possible, but that's not the issue. The issue is not like carnivore versus keto versus paleo versus whatever. The issue really is detoxing. That's why if you read through the book, there's nowhere in the book, I don't think there's anywhere, we'd never mention the word keto. We don't even mention that you should measure your ketones. I mean, yeah, it is a ketogenic diet, and it is kind of similar if you look at what Robert Atkins wrote in his book in the 1970s. The Atkins diet was a ketogenic diet. It's a keto diet, and it was a 20-gram carbohydrate diet, just like ours, right? But I think that I've tweaked it a little bit to where you have all these free foods that you don't even have to measure the carbs in. So if you're eating broccoli and cauliflower and celery and spinach and lettuce and all that stuff, you don't count that. Don't even count. That's not even in your 20 grams of carbohydrates.
Yeah.
So the only things that I count nuts and fruits like tomatoes and blueberries. So when I eat those kind of things, I count. I look at if I'm doing, peanut butter on celery or something, I count. Okay, I can have 2 tablespoons of peanut butter and still stay within my 20 grams. But I don't count broccoli at all, even though, yes, it does have carbs. It's got a few carbs per serving. But we call them free foods because we want you to be able to eat those as much as you want because they're not going to contribute significantly to your toxicity of glucose. And so we're looking at this as a detox program and not a weight loss program or a keto diet program. That's not really what it is. It's just detoxing.
All right. So I'm not sure if it's Maddie or Mady. What food should my son eat? What food should
He
my
should
son
eat good
not
food.
eat?
Okay, what he should not eat. He should not eat.
Besides desserts, sugary drink, as he found out he is pre-diabetic.
You know what's really simple? Just don't eat anything that you can identify. If it has a list of ingredients, don't eat it. That's as simple as it gets. So if you could look at a broccoli, oh, I know what that is. That's broccoli. If you can look at some sugar snap peas, okay, that's fine. You can eat that. You can look at a carrot. You can look at a steak. You can look at some chicken. If you can identify all the ingredients just by looking at it, then that's good. If it has a list of ingredients, don't eat it.
And if you really want help, guys, the Diabetes Solution Kit is really a good place to go. Yeah. Honestly, if you're just getting started and you're like, what do I do? I'm so confused. Start here. This is the best option. And you can find that at bartonwebinar.com. Oh, we're running out of time. Okay. Let's see here. Dwight says, I was recently diagnosed with age-related macular degeneration. Is that diabetes 2 related? I have family-related glaucoma prior to diagnosis of diabetes 2.
Okay, so both, so the glaucoma, the diabetes 2, and the AMD are all related. And related to what? To energy production. This is the inability to use energy efficiently. So when you deal with one, you deal with all of them. So getting sufficient antioxidants, so something like the Eagle Eye Vision supplement to make sure you're getting enough antioxidants, because these antioxidants have been shown to stop or reverse age-related macular degeneration. So that's something that is worthwhile. I don't know if you need it or not, but for heaven's sakes, it can help some people. And we have no way of knowing specifically it's going to help you. But what will help is getting rid of your insulin resistance, is having really good insulin sensitivity. And the phase 1 of the program is a wonderful way to do that.
Okay. All right. Julia said, I spike over 30 points from veggies like broccoli and cauliflower. In this case, should I count them?
Oh, that's interesting. So just eating broccoli, your glucose goes up 30 points.
Well, I mentioned this last week. Do you like broccoli and cauliflower? Because if you don't, and you're stressed out eating it, that might.
Yeah.
I think I do that with food. So just a thought.
Yeah. Is it a stress reaction? That's what you're asking. Well, I don't know. Should you count it? You know what? I don't think so. No, I don't know how you can possibly get an oversupply of glucose by eating broccoli and cauliflower. I don't know. What do you put on? Hey, you know what? If you put cheese on it, the cheese has a lot of fat. can make you resistant to insulin, and then the broccoli and the cauliflower can spike. So so it could be like something you're putting on it, some sauce you're dipping, or cheese or something like that. But if you're just eating plain broccoli and cauliflower, it's going up 30 points. Wow, that's I I don't know. If I had a patient that had that, what would I do? I would do a glucose tolerance test with insulin. I would say, what the heck is going on with this insulin resistance? And I actually had a case of someone who I believe now has, I'm still working with her. I think she has an insulinoma, which is an insulin producing tumor in the pancreas. And that's where her diabetes came from. Her insulin resistance came because she was making this extra insulin. So she's getting more and more insulin resistance. We did the test, and normal insulin is fasting around, it's around 5. And then after eating, it goes up to like 20, something like that. Some labs are like 25 or even 30. 30 is pretty high. She went up to 95 after eating. Her insulin went up to 95. So like 3 to 5 times what a normal person would go. And so we're working on trying to find where this like excessive amount of insulin is coming from, because it's not due to like a heavy glucose load. She would eat a little piece of bread, like little, and it would hurt, and she would pass out from the insulin would shoot up, and her blood sugar would drop down, and she would pass out and get hypoglycemic. So, if I were your doctor, I would start searching for what's going on here. There's something wrong.
Well, and Julia did say she must be eating it with the rest of, it says rest of my meal, total net carbs less than 25. So she's eating it with something else.
Yeah. So if there's fat in the meal, it'll tend to make you insulin resistant. And if you're having one meal with 25 carbs, that's kind of high also. So, yeah.
Okay. It is time for you to go be with your patients. Thank you again for another great webinar, Dr. Saunders, and we'll see you tomorrow.
Okay. See you tomorrow.
Bye. And thank all of you for joining us today. Again, you can go to bartonwebinar.com to get more information about these webinars. Tell a friend, send them to the website. And again, use code webinar25 to purchase anything that you see there. That is one word, webinar25. All right. We'll see you tomorrow. Those of you